Hello, I'm Dr. Poojitha, Fertility Consultant at Akkineni Hospital. Hope you're doing well. We'll be discussing some important aspects today. Stay through the session and note them.
If you've ever gone online looking for fertility advice, it can get really overwhelming fast. It just feels like you're drowning in this sea of conflicting information, personal stories, and old wives' tales. It's confusing, it can be super stressful, and honestly, it's just hard to know what to believe. And that's exactly the problem. A fertility consultant like Dr. Poojitha sees this every single day in her clinic. It's this constant battle between these really common myths and the actual clinical science. So that's what we're going to do in this explainer. We're going to cut right through all that noise and get to the clarity, to the stuff that's backed by science. Ready? Okay, let's dive in. All right, first up, we are tackling two of the biggest, most persistent myths out there, the ones that revolve around age and who's responsible when things don't go as planned.
Okay, this is a huge one. It's this idea that's just so baked into our culture. For a lot of people, it's not even a myth. It's just treated as a straight-up fact.
I mean, it seems to make sense, right? Youth equals health, and health should mean getting pregnant is easy. But is it really a guarantee? Does the science actually back that up? And here is the reality check. The myth treats age like it's the only piece of the puzzle. But the fact is, age is just one piece. It definitely helps, don't get me wrong, but real fertility depends on this whole combination of things: your hormones, egg quality, lifestyle, and your partner's health. And that leads us perfectly into our second myth, one that has caused so much unnecessary blame and shame for generations. For literally decades, the story has almost always focused on the woman when a couple struggles. But what does the actual data tell us? What does the science say? And here it is. This is so important. Infertility is not just a woman's issue. The science is crystal clear. About 40 to 50% of all cases involve male factors. That is a massive number, and it proves why a full evaluation has to include both partners right from the very beginning. And when you see it like this as a chart, it becomes even more obvious. I mean, look at that huge slice. Nearly half of all cases involve male factors. This one visual just completely reframes the entire conversation. It's not about blame, it's a shared health journey. Okay, let's keep going. Next up, we're diving into two topics that can feel a little more hidden, a bit more misunderstood. We're talking about secondary infertility and the real role that stress plays in all of this. Now, this one can be so confusing and honestly really isolating for people. The thinking kind of goes, well, it worked before, so it has to work again, right? But for so many people, that's just not how it plays out. This situation actually has a clinical name. It's called secondary infertility, and it's defined specifically as not being able to get pregnant or carry a pregnancy to term after you've already had a successful birth. And here's the thing. It is way more common than people think. Our bodies are not static, Between pregnancies, our health can change, we get older, our lifestyles can shift completely. Having a baby is a wonderful thing, but it's not a lifetime guarantee for future fertility. Yes, the stress myth. I am sure every single one of us has heard some version of that well-meaning but totally unhelpful advice to just relax and it'll happen. So let's get really clear on this one. The myth suggests that stress is this single direct cause. But the reality is that while, severe stress can be a factor, it is very rarely the only cause. So managing stress is fantastic for your overall health, for sure, but it's not a substitute for checking if there are other underlying medical issues going on. All right, for our final section, we are stepping into the world of high-tech medicine to tackle a myth that's really born out of hope and maybe some misconceptions about what modern science can do. IVF, or in vitro fertilization, is so often talked about like it's this ultimate safety net, right? Like it's the guaranteed solution when nothing else has worked. But that way of thinking can create some really unrealistic expectations. The truth is, while IVF is a genuinely powerful and incredible medical tool, it isn't magic. It's science, and its success depends heavily on a lot of different things, especially a person's age, their specific medical situation, and getting the timing just right. The good news is the science is always improving, and outcomes are getting better all the time. Okay, so we've just busted 5 major myths. But now what? This final section is all about taking that information and turning it into confident, clear action. So here are some clear, science-backed steps. First, know the timeline. A good rule of thumb is to talk to a professional if you've been trying for over a year, or for about 6 months if you're over 35. Second, get an early evaluation for both partners. And third, and this is maybe the most important, trust science, not the myths you hear. Ask questions and go find the right help for you.
And really, that's what this all comes down to. In a journey that can feel so out of your control, having the right information isn't just helpful, it's powerful. It can absolutely change everything.
So we'll leave you with this one question to think about. When it's about your own health, what are you going to choose to base your decisions on? A myth or a fact?